YouTube. So it's Wellness Wednesday, Women's History Month edition. I wanted to talk about breast cancer screening. Breast cancer screening is very important. Breast cancer is the cancer that has the highest incidence of cancer-related death or cancer-related incidence in women in the United States. There are lots of different reasons that can increase your risk for breast cancer. Avoiding these things could potentially help to reduce your risk for breast cancer in the future. The recommended age by the USPSTF. The USPSTF recommends that all women starting at age 40 receive breast cancer screening with a mammogram. Mammograms are typically a procedure that you get done at a radiology or a diagnostic center. They are painful or uncomfortable, at least based off of what I've heard. They have decreased the risk of cancer-related death significantly. However, mammograms are not perfect. Sometimes on women with more dense breasts or breasts with certain different abnormalities, or even with specific types of cancer, things can be missed. So that's why it's important to go and get your annual or even every 2-year cancer screenings. Follow up if there was something abnormal and make sure you ask your doctor for your specific results. If you are also wondering what other ways can I try to make sure that I'm preventing or being on the lookout for breast cancer risks, you can do your self-breast exam. Sometimes that's just an inspection exam where you're standing in the mirror, you take a look at your breasts, you're looking for lumps, bumps, skin changes. You can start to have lots of little micro dots on them, color changes in your breast where one breast becomes very dark or one breast becomes much larger or weirdly shaped compared to the other. Breasts are often not the exact same size, and that's okay, but one shouldn't be so large compared to the other out of nowhere. If it wasn't always like that, maybe you might want to go talk to your doctor about it. Other things that are really significant are breast discharge or nipple discharge. If you have bloody nipple discharge or any kind of white milky discharge, even sometimes clear discharge when you're not a breastfeeding mom, those are things you want to go and get checked and talk to your doctor about. Another thing is doing your own breast exams manually. So standing in the shower usually at least a week before or a week after your period, put your arm above your head, take the other 4 fingers, massage around the breast, light palpation harder than what I'm doing right now, and then get closer and closer to that nipple line. Take a light squeeze, make sure there's no discharge, feel inside the armpit, along the collarbone, and repeat the same thing on the other side. Make sure you touch on the in-between area to make sure there's no lumps, no bumps, no tenderness, no pain. And if you find nothing, great, and repeat it again in the next couple months. These are ways that we can reduce breast cancer risk. This was my Wellness Wednesday fact. I hope this was helpful. Stay healthy, guys.
But look at you. Look how far you've come. You faced your trauma.